Hi, this is Brandon with Chirop. I'm here with Mark Bronson of the Evidence-Based Chiropractor Facebook page. But more importantly, what we're going to talk about now, and we're going to talk about in the next 15 minutes, is how you're merging that Facebook following, your following, and really the following that's happening in the chiropractic world, and how you're turning that into the Evidence-Based Chiropractic Network, which will be released, I believe, in June, correct?
That's right, Brandon. June 1st is when we're ready to go.
I'm super excited about that. And I think that the reason I'm excited about that and the reason we're interviewing you today is because there is a little bit of difficulty in staying on top of what is coming out in the evidence. So I want to know how you do that, kind of where your mindset is and when you're reading different kinds of research. And then I think how to actually incorporate that into practice. So one, thanks for being on board. And I think the number one question that I have for you is how do you look at these specific pieces of information, journals, research, or any other kind of content, and how do you determine what's credible and what's not credible?
Thanks for the question, Brandon. So it's a great question. Let me preface it first with a little bit saying, depends kind of what we define credible as, so everyone's on the same page. But in general, I'll just give you a couple of examples. So we can have, for example, a kind of a high quality study, which I would define as having very low indicators of bias, sound reporting methods, good stats, good kind of conclusions, published in good journals. But because the findings might disagree with some people's beliefs and biases, they might not find that information very credible, despite objectively it being. On the contrary, we have some other scenarios where, you might find a case report that really is kind of floats your boat. It really kind of meets your biases, but, might be published in, in a journal where the editor, the publisher, and the sponsor are all one and the same, which introduces a lot of bias and a lot of problems. To kind of circle back, I think that you have to kind of look at where you're getting the information from. For me, I just have a very general strategy. I go on PubMed a little bit. I'll type in, musculoskeletal or chiropractic or rehabilitation or whatever topic I'm looking for. For me, I will generally go towards systematic reviews and meta-analyses. I do that because there's secondary studies and they tend to review all the primary studies. So you get a really good kind of summary of what's kind of going on. And if I have any questions or problems, because I'm by no means an expert at doing all this research, appraisal, and critical analysis. I think I'm pretty good for a clinician, but I will also defer to my colleagues who have their masters and PhDs if I have any questions about it, and kind of go from there. I also take advantage of the social media networks that we have right now. So you could, whether it's on Instagram or Twitter or Facebook, there's some really good clinicians and researchers out there who share the research. And so I just try to keep tabs on that and do the best I can to try to kind of stay up to date. But like you said, it's very difficult being a clinician who is, in full-time practice, working with your patients, doing the care, maintaining your business practices in your home life too. So those are just in general what I tend to do.
So let's look at what it is you really do on a weekly or monthly basis. Who are the people, who are the services, who are the podcasts that really make it easy for you to gather that information and then use it with patients on Monday?
Yeah, thanks, Brian, for that question. Again, this is just kind of my personal biases. So I really, one of the most informative things for me is a service called Research Review Service, which is put out by Dr. Sean Thistle here in Canada.
He's
And
great.
basically, kind of what that is that he's the one who's going to do the deep dive and the analysis and the appraisal of the paper for you. So kind of, if you're looking, an easy way that you don't have to kind of go over the research yourself, and you might not, you might be a little bit unsure of how to go about it. Sean does a really good job of presenting that in a very multiple formats. There could be MP3s. You can kind of read the text over a variety of clinical topics related to neuromusculoskeletal health. So that's what I kind of use. Podcasts. What floats kind of my boat right now is the Canadian Chiropractic Guideline Initiative podcast. I find they produce really helpful information. I like the BJSM podcast as well too. I'm a bit more biased towards sports and rehab in my practice. And then of course, we have I really enjoyed Dean Smith's chiropractic science, podcast, because in that particular case, you get the one-on-one interview with the researcher, and you get to understand their motivations of why they chose a certain research question, why they went about that certain way, and really gives a good dialogue between clinicians and researchers to try to kind of bridge that gap. So ultimately, we can kind of implement this stuff into our practices, which is really kind of the hardest thing to do. It's easier to find the research than it is to implement it. And so I
Well,
think
yeah.
going kind of forward, that's something that a lot of different people are working to try to bridge that gap.
Yeah, that whole knowledge transfer system to get what we know, obviously the research and the credible information, and then to deliver that to our patients is a whole whole different art form, which we're all trying to race it to do in a reliable and credible way. Let me ask you this. So if I had time to go to one seminar this year, if I had to really go learn from one person or one mindset, who would that be? Who would be on the top of Mark Bronson's list?
It's another really good question. And I'm going to do a little bit of a pivot and say, rather than a single person,
Hmm.
because my clinical interests might be a little bit different than others out there, I'll tell you what when I went to recently, I thought that was superb, and that was Dr. Morgan's Parker seminars in Vegas. I could not have said this 5 years ago in terms of me attending. It's just the content and the format wasn't something that I was personally interested in. But over the years, since Dr. Morgan's taken over, he's really made Parker much more adaptable to the modern realities of practice. And when I went over there, in Vegas, it was like a buffet. There was something on the menu for everybody that they could choose, whether you liked more, research papers to read about that or clinical science, a bit of business practices. But if you have to kind of choose one this year, for me, it was Parker, and I think it's going to be swinging around again in October. So, watch that space.
There's someone who's going to be speaking there in October. I'll have to get his name from you, but I think it ends in steel. I think he'll be speaking there. He'll be. I'll tell you what. You're right, and I think that it's difficult to determine what seminars go to. And one thing that I've noticed is that he has done a phenomenal job. And going to a Parker seminar wouldn't even been on my palate to say out loud when I first got out of practice. And now it is a highly coveted place to go because of what he's done and because of what's happened with, providing that buffet of information. I know Brett Winchester was just there, one of the gurus in the profession who's doing it right. So he's definitely bringing in people who are doing it right and have some valuable information that we can all use. Let me ask you this.
Yeah, and it was
Oh,
multidisciplinary this time too, right? I'm sorry to
yes.
cut again, but it was multidisciplinary. So it wasn't just kind of chiros that was there. There were some physical therapists that were there. There was occupational therapists that were there.
Mhm.
There were some physicians that were there too. So kind of gone are the days where we're in this little silo island. And I really think that kind of Parker reflects this kind of modern interdisciplinary collaborative nature. And for me, anyways, it was really visible when I went to Vegas.
Yeah. Uh, Speaking of Parker and a lot of different schools are moving toward that evidence-based model that I think really is tremendous for the rest of us, really. However, what is a common thing, just as an educator, that you see that students are doing now that they really shouldn't be doing? What's one thing a student could start to focus on now that's going to help them in practice later?
So although our viewers might not know this, I am getting a little bit up there in age, and I've actually I've been out of school now for 14 years.
Yep.
So I'll tell you what what I did wrong or what I could have improved on now that I kind of think about it. And for me, it was probably a little bit more in my interviewing, my history taking, and really teasing out what nowadays are really important psychosocial variables. So back then for me, it was really like movement based. You're not laterally bending well, and let me help you out with this. So you have this activity limitation, let me help you out with that. But I rarely inquired about their beliefs, their expectations, their mood, their sleep, their job satisfaction, and all these other prognostic variables, which would have really kind of helped me out when I had kind of the case, and maybe it wasn't going the way I wanted it to. I was missing a big kind of chunk of the pie in terms of what I could be doing better and address that in a way that was much more holistic, which is kind of our foundation, right?
Oh
So
yeah.
for me, that was something in retrospect I wish I would have done better, and I think the newer generation are getting a better taste of that as, for example, motivational interviewing becomes more and more kind of common practice, and we're becoming more aware of all these social determinants of health that really are what kind of drives overall outcomes, as opposed to restricted segmental motion somewhere.
Yeah, I definitely agree that as we grow, unfortunately older, I'm the same way. I'm passing my 10-year mark in practice that I hate to admit, but I find myself really automating 98% of everything that I do in my treatment room, so
Yeah.
I can get creative on those pieces of information that I gather in my history taking in my conversations, and I can really focus on that one aspect. Maybe it is sleep. Maybe it is, their satisfaction with their home life. And by no means am I a psychologist, but I am someone that is able to assess and to address those things with those people. Even though they're coming in for one problem, we can hopefully find a way to help get them out of that problem, which may not be exactly their elbow. It may be the things they're doing to impact that pain or problem at their elbow. I think finally, so gathering 14, 15 years in practice,
Yeah.
what is a common mistake that you see that chiropractors are doing now, whether it's Canada, whether it's the US, people around the world? Your network obviously is around the world and it's growing by the minute. What is the common thing that you're reading or seeing with practitioners? What are the problems that they're having that you can kind of synthesize and develop? What would you do for that specific problem?
I'm gonna narrow it down a little bit to probably the early career practitioners, which is kind of what I see a little bit more often. They're the ones who ask these questions a little bit more. And there was an example that just happened yesterday in the group where we were discussing about radiculopathies, and how one member who was a bit earlier in his practice, kind of felt that after 4 to 6 weeks and there wasn't much improvement, they were going to get ready to discharge. And I suggested that that might be a little bit too early because, in general, it's about 3 months of conservative care, assuming there's no decline in neurological function, that you should they should allow for radiculopathy before you maybe move them forward towards, injections or more invasive kind of procedures. So in that kind of particular case, they were jumping out, they were kind of closing the case a little bit kind of too early, given that particular diagnosis. So sometimes we have to be a little bit more kind of patient, especially when the case is a bit more kind of complex, or the diagnosis is a bit more kind of involved, and not be too quick to shoo them out of our office, because the alternatives out there, other than conservative care, a lot of them don't kind of fare that much better in the long run. So I made that mistake myself too in the beginning, where if they weren't getting better by a certain amount of time, I was very quick to say, okay, well, maybe we got to send you kind of elsewhere, not kind of recognizing that, this person is a complex person. It's a bit more of a complicated pace. They have a lot of comorbidities going on, a lot of psychosocial variables, and you just can't do all that in 1 or 2 sessions. And I've gotten better at communicating. So we're talking a bit before of asking these questions about mood, sleep, beliefs, and expectations. And so I think over the years I've become a better communicator, and that has happened by listening more. So I think I did a little bit more talking earlier in my career. I'm doing a little bit more listening now. And so when I do speak, I think it's a little bit more impactful, and I'm able to convey that information a little bit more succinctly and concisely than I have before.
Yeah, thank you for all this. And really, the reason that I like to do these interviews is to listen to people who are doing it right or have learned from doing it wrong, which we've all done. So just to kind of recap what we've learned so far is that we need to be finding credible information. Things like PubMed, looking through systematic reviews, looking through meta-analysis, really give us an idea of the good information that's out there. And of course, talking with colleagues. And it's
Yeah.
always a good idea to talk with colleagues that have a similar vision, but maybe they don't believe everything that you believe. And most importantly, to take your beliefs out of it and sometimes reassess your beliefs with credible information. As far as information that you find credible, that I definitely would 100% agree with. Sean Thistle does a phenomenal job with RRS, and there's tons of other different journals out there that do well. I do want to bring up one thing is that I came back from soccer practice one day and I look at my in my car and my 12-year-old said, "Who's Dean Smith?" I've been listening to this guy talk for like 10 minutes. I'm like, Dean Smith? What? And it was on my car, and I had his podcast downloaded, and my 12-year-old was listening to him. So once again, I don't know Dean Smith. I'm not here to really say that I do, but he does have great information for those of you who are listening. Second, Parker's doing a great job putting out information. It's different classes like Motion Palpation Institute, like Factor, like all these different classes. You got to learn from these people and really take all that information and synthesize it and turn it into your patient care and make it your own. So thanks for bringing that up. In closing, I think you're right. I can't disagree with anything that you said. That the more that we listen, the less that we talk, the more we can learn about everything that's going on with the patient, and hopefully address the most important stuff with our care. So I really want to thank you, Mark, for taking this time with me. I think that what you provide the profession is invaluable. So I want to thank you for that, and I really am excited to move forward in the future. I think what you're doing with the evidence-based, chiropractic network is going to be great. And if there's anything that we can do here at Chiro, please let us know.
Absolutely, Brandon. Thanks for giving me the opportunity to talk to you today. Likewise, I'm very impressed with the work that you've done with kind of Chiro Up and your leadership for our profession too. And I'm just going to kind of close along with this, that this has been a journey for me. I didn't get to this state overnight. There's been a lot of learning going on from my own mistakes, right? Failure, first attempt in learning. And also to just making sure that you're aware of your limits. We're not going to be good at everything, and we have different strengths and weaknesses too. So as long as you can just be realistic with yourself, say, I might not know this area very, very well, but I know someone who does. And then you can kind of get in contact with them, and then be vice versa. Maybe there's an area that you're more passionate about and more expertise in, and you can do that too. So it's all about having open mind, open ears, and then, rubbing shoulders and elbows with the best. We stand on the shoulders of the giants who come before us. And I'm really honored that, our generation now is being able to contribute to the evolution of our profession.
Absolutely. Well, thanks again for being on board, and I look forward to talking in the future.